Oh, some sort of... Oh! Man!
No, I'm not all right, my...
That's horrible.
You idiot!
Holy cow. Whatever he ran over and shot out of the lawnmower straight into Quagmire's head. Horrible. It's good at least that he's pushing pressure on it.
Take your hand away.
Oh, it's stuck in there. Ah! Okay, don't pull it out. Okay, don't pull it out. Make sure that you go to the hospital right away, because if you pull it out and you've severed something or you've punctured something and now you remove it, it could get even worse. Let a doctor remove it in a setting that an emergency then can be taken care of if it gets even worse.
Oh my God, a piece of your brain came out.
Oh my gosh, don't do that.
Maybe it's not so bad. I can feed it to my pet zombie.
Well, I guess brain is tasty to pet zombies, but that's horrible. Don't pull anything out that is impaled into your body. Go to the closest emergency department right away. Stabilize whatever is impaled in your body. So if it's this huge fence or a big stick, stabilize it so it's not bending all over the place as well. Moral of the story, do not pull any impaled object out of your body, even if your friends try to convince you. All right, number 2 clip.
Mrs. Griffin, it's a good thing you brought this child in.
Why? Is he okay?
I'm afraid he's very sick. In fact, his lab work shows he's suffering from Hodgkin's lymphoma.
Oh no.
Scotty has cancer?
I don't know, I didn't read the whole Wikipedia entry between the 80s.
Okay, hold on. Okay, we'll talk about Hodgkin's lymphoma in a moment. But when the doctor says he looked it up on Wikipedia, I think you want to turn and run the other direction. Wikipedia is not a medical source. Yes, we look things up on medical sites, not Wikipedia that anybody can add information to. That's horrible. Doctors never do this. Oh my gosh, he backed away and has a tip jar there. This is absurd and non-professional.
Do you have any idea how expensive medical school is?
No, I don't.
Well, it's probably pretty expensive.
Oh my gosh. Okay, let's break this down for a second. Hodgkin's lymphoma and non-Hodgkin's lymphoma has to do with a type of cancer relating to your lymph nodes. The white blood cells of your body are being made inappropriately, and in this type of cancer, you'd have different therapies that you do, radiation and chemotherapy. Most of them are treatable, and people do really well. But then this doctor goes into describing his medical school debt. Yes, after 12 years of education and schooling, doctors have a lot of student debt, but never in my career have I ever heard or seen of a doctor pulling out a tip jar. That's horrible. Let's check out video clip number 3.
My stomach! I think my hernia ruptured! Oh my God! It's bad.
A hernia ruptured. We get patients in the emergency department all the time that are worried that the hernia is going to rupture and burst. Typically, the hernia won't rupture and burst. It'll actually get closed off and tightens, and we actually have to try to push this back in. And we actually end up putting it back in majority of the time in the ER by just deep, hard compression to that area, and eventually the body just sucks the intestines back into the abdomen.
No, she can't! Thanks to you, I don't have insurance anymore! What are we gonna do? I'll get the gun!
That's a real concern when people don't have insurance. They don't go to the emergency department for emergencies. Don't ever do that. Please come to the emergency department even if you don't have insurance or your unknown status of insurance, okay?
Just look it up on your phone or something!
Ugh, hold on, I've got to update iOS. Okay, got it. It says I have to make an incision.
Oh my gosh.
Hernia sac, and then suture the abdominal lining.
How am I supposed to do that? Grab my tool belt!
Okay, do not perform home surgeries, okay? This is hilarious. But if it is incarcerated or strangulated, that's the hernia itself, that is actually when you do have emergency surgery that is performed by a surgeon, where they actually do the incision, they pull the intestines back through that hole, and then close that defect. Most of the time, they actually use a piece of mesh, and then they have to close back the skin. But let's check this out.
Sharpening linoleum blade. Ah! And then hold the incision open with a vice grip and use the slip joint pliers to get the muscle back in position.
Okay.
Okay, this is pretty good. He's doing it without any anesthesia. I do not recommend that.
Now it's saying I have to suture it.
I've got some monofilament line you can use. It's from aisle 8 above the chains and cables.
Monofilament lines.
Actually, it's pretty impressive.
What to say, Brian?
Monofilament line, slip joint pliers, it's pretty impressive, right? Even Stewie says it's impressive. But monofilament line, like we use different types of nylon type materials or even dissolving materials that are different sizes like that. But we definitely use some sterile, tools and sterile fields and all that stuff so we can prevent infections.
It seems like you really did learn something.
His bloody hand.
So
did. But please, stitch me up. Just be careful and take your time. This is the delicate part, because...
Yeah, I'm gonna just use the staple gun.
Okay, the staple gun. We actually do use this medical stapler in the emergency department and sometimes during surgeries, but this one is hilarious. Pretty much, that was really good and pretty accurate. I just wouldn't do it in the home of the Family Guy setting. Obviously, we need a sterile field, but even more obviously, probably a child shouldn't be operating on their own dog. So hernias is when an organ pushes through an area that it shouldn't. Typically, the most common is like your intestines, where the small intestines pushes through, and like your groin through the muscle wall, and it's protruding out. Increases the risk of having an injury to that tissue by decreasing blood flow, so you need to put it back in. Otherwise, if it's left out too long, decreased blood flow causes ischemia or dead tissue to that area, and it needs to be operated on. All right, clip number 4.
Excuse me, I have
Looks like the pharmacy setting.
for 25 minutes.
Oh, I'm really sorry, Miss Dumont. We'll have that filled for you right away. Guys, what the hell's going on back there? Remember, each pill has to go into the correct bottle.
This ain't so hard.
Oh, Nelly. Okay. Oh. What? I don't think they're watching anything that they're doing. Okay. This scene takes place at a pharmacy. Sometimes pharmacies take a long time to process your medications. They have to count it out, make sure it's going in the right bottle, right label. In this setting, they're just getting random pills on a conveyor belt, going through different bottles and just putting in, and then they can't keep up, so instead they're just trying to eat it all. Bad idea. Could be mixing different types of medications that can have very serious consequences. It is not like this in a normal pharmacy. Things are set out appropriately, very sterile and clean, and they're counting them with specific devices and making sure that the label is matched up with the medication and the appropriate number so the patient gets exactly what is on the outside of the bottle. Let's check out video clip number 5.
Thank God. I really dodged a bullet there. I don't know what the hell I was thinking.
Everybody makes mistakes. Even doctors.
Happens. Oh! I'm sorry for laughing. Wasn't expecting that. Yes, doctors make mistakes, but I've never seen a doctor blow up a patient. Typically, those are the paddles that we use for defibrillation and CPR, or when somebody's heart is in a funky rhythm that we need to shock it out of. It is very controlled, and the only thing that we really worry about is making sure the patient doesn't feel any pain, and that nobody else is touching the patient, because if somebody's touching the patient or the bed, that electrical charge energy can actually be transferred to somebody who's still touching either the patient or the bed. But I've done this procedure many times, and I've never had a patient explode on me yet.
What are you doing, Peter?
I'm making my own Red Bull. Lois can't stop me from experiencing the manic highs and lows my body demands.
Whoa, hang on. You're adding kerosene?
Oh my gosh, I love the ingredients.
Peter, that's insane.
Yep.
That'll destroy your body.
Kerosene is fuel, Brian. Red
No.
Bull is fuel. Kerosene is Red Bull.
Oh my
I want you to leave me
gosh.
alone while I'm
It's gonna
doing my important
explode.
work.
No.
Peter, that
my
drink
gosh.
will kill you. Brian, whatever kills me makes me stronger.
So whatever doesn't kill you makes you stronger, not whatever kills you makes you stronger.
See, Brian? I feel great.
Oh, jeez. Oh!
Peter? Peter, are you alive?
Nice. So kerosene's a type of oil. Don't use things that say like toxic or have like the skull and crossbones on it, or have used for external use only. Do not ingest these things. There's specific reasons why.
Dr. Hartman, please tell me, is my husband gonna be all right?
Cancun, actually. Thanks for asking. Just got back. Mr. Griffin, I'm afraid all the toxic chemicals your husband ingested from his homemade energy drink have caused total kidney failure.
Oh my God! Kidney failure?
Some different types of things that you can ingest can cause kidney failure, such as antifreeze is one of them. People will drink that because there's an alcohol component to it, but it can actually clog up your kidneys and cause renal failure. Just don't ingest anything that you shouldn't. Kidney failure, different things can actually erode your esophagus and your stomach and your lining, cause gastrointestinal bleeding.
But is he gonna be okay?
Well, yes and no. We'll put him on a kidney transplant list,
Whoa.
but that could take months. Until a donor is found, he's going to have to undergo dialysis treatments 3 times a week.
Dialysis?
Yep.
Is there any other way?
Whoa.
Yes, there is.
No. We'll do the dialysis.
We need our kidneys to function to get all the toxins out of our body. We then will say, okay, you need hemodialysis, which is what everybody refers to as dialysis, where you get a big IV line in, and literally it's taking your blood out of your body into a machine, cleaning it up, so to speak, and then putting it back in. People have to sit maybe 4 hours a day, 3 times a week to have this done so they can function. 3 weeks later.
Hey, Doc, I'm here for my dialysis.
Ah, have a seat, Peter. Let's get you hooked up.
Doc, I don't know how much more of this I can take. It's been 3 weeks.
I know, I saw the caption.
I just go crazy just sitting here for so long.
Oh, I know it's tough, but maybe there's something I can do to make it easier. Here, play with this bucket of afterbirth.
Oh my gosh. So afterbirth is another word for the placenta. That's disgusting. And he's picking up with his bare hands. Oh, what? That's horrible. But yes, dialysis can be very boring, but it's necessity because if the electrolytes go haywire, it actually could kill somebody.
Oh my God! That shark's attacking Quagmire!
I think it's got him by the wiener.
Oh, that's horrible. Oh my gosh. Oh my gosh, that's horrible. All right, shark attacks are a thing. It's all bandaged up, okay.
Doc, give it to us straight.
What'd they do?
What's going on with our friend?
Well, Mr. Griffin, there's no easy way to put this, so I'm just going to come right out and say it. He's black.
Not that friend, Quack.
What? Oh my god. Oh, that's horrible.
Okay, but you're going to have to learn to live without a penis. Or will you?
Oh, that's so messed up. That is so messed up.
That is kind of rad.
Your gift is inside.
Oh my gosh, what is this?
Is that your...
Yes, Glenn. It's my penis.
Oh my gosh.
After my surgery, I kept it in my freezer. I want you to have it.
The likelihood that this organ is viable is probably 0 to 0, but it's a nice gesture. People actually do this all the time with kidneys. Never really heard for a penis.
I'm so nervous for Quagmire.
I know, but it's nice that they served hot dogs for the surgery.
There it is. Give me that.
Oh my gosh, he stole the doctor's food. Here we go. So a urologist would specifically be doing
Nurse,
this.
you put it on there. I'm not gay.
Oh my gosh, that's horrible. Anatomy is anatomy. Physicians don't ever say that. We look at everything from an anatomical viewpoint.
The operation was a success.
Congratulations,
Nice.
Quagmire.
Thanks, guys.
All right. He had a successful replantation of his penis, so hopefully it works. Usually after surgery like that, you'll probably have a Foley catheter in place. That way you can drain fluid out, aka urine, and that way there's no issues having to urinate.
Okay, heart sounds good. All right, Mr. Griffin, I'm just going to need you to drop your pants and we'll check your prostate.
What?
Drop your pants, turn around, and lean forward.
Okay.
Again, he's not wearing a hospital gown, so we need to do that. Dropping your pants to do a prostate exam, it's just so blunt. I think the easiest way, the nicest way for a patient, unfortunately, is to maybe lie them on their side, cover them with like a sheet or a blanket, and only expose the buttocks and do the procedure. The whole procedure's not comfortable.
So how's this work? You just feel my pulse?
Oh my gosh. Whoa. The prostate sits right next to the rectum, just below the bladder. We're looking to do a screening test to see if there's any lumps, abnormal growths, those sorts of things of the prostate, so we can detect prostate cancer early. So you do a digital rectal exam. You use a gloved hand, and you actually talk the patient through it, because if the patient is fighting against you, it's a muscle, so you can't get in. There's no sneak attacks when it comes to a prostate exam.
Mr. Griffin, that's a prostate exam.
Shut up! You had your finger in my ass!
That's how a prostate exam is performed.
Oh my gosh.
Now, if you'll just let me...
Get away from me!
Oh my gosh. It's not funny, but it's funny.
What happened?
I was raped.
What?
Even his wife's laughing at him.
He took my innocence.
What? Peter, that's a prostate exam.
Yeah.
It's an important part of a physical for men your age.
You sound just like him.
It is true. If you don't know what you're getting into, if you don't know the reason why or what the procedure is, you might actually feel like you are being violated. But a doctor's job is to explain what we're doing and why we're doing it. A patient can always refuse a procedure or a test, anything that we do, understanding the reason why we're doing it, the risks and the benefits of doing the procedure.
So, what can I do for you, Mr. Swanson?
Doc, I can't take it anymore. I want to walk again. I'll do whatever it takes.
Well, there is a highly experimental new procedure. It's essentially a leg transplant.
What? That's cool.
Sign a waiver. I think I may be able to help you.
He's paralyzed, right? His legs don't work. A leg transplant won't specifically work. So if he had a spinal cord injury, putting on a new set of legs, if the information to the legs is still in error, it's not going to work. Hopefully, we're going to move into the future where we could potentially have these new neuroconnectivity to previously paralyzed parts of our body that can then work. That'd be really cool and awesome.
We'll select the legs most suited to your body from our inventory of donors.
I love it. I love it. Okay, there you go. Nice. I love the different options. At least you can see what the future holds.
Ah, good choice. These are the only ones we have in stock that aren't hilarious.
I'll take them. All right, Doc, I trust you.
Good. Now I'll just pop in the how-to video and we'll get started.
Oh my gosh.
What?
Oh
Hi,
no.
I'm Jamie Farr.
You never want to hear that before you're going down. So typically when you're going for surgery, you will be given medications in the IV. But you never want to hear a doctor say, let me just go look it up on a video, or I've never done this before, or this is my first time. You don't want to hear that. Every doctor needs to be trained appropriately for the procedures that they do. Like myself, I've been trained specifically for the procedures that I do in the emergency department. If I'm not credentialed to do something, I shouldn't be able to do it, and I shouldn't do it.
And you're about to perform leg surgery.
Oh no, let's see what happens.
He's been in there an awful long time. I hope everything's all right.
I'm assuming it's going to take a long, long time.
The new Joe Swanson.
Oh my gosh. Whoa! I see the leg. Look at him. He's so standing proud and walking.
Well, what do you think?
It's a miracle.
Great, Joe. Holy crap.
They still got that new leg smell.
I put his old legs in a bag if you want.
Oh, that's messed up. That's messed up. First off, it's a miracle that that happened. Again, with spinal cord injuries, the limbs are not the problem. It's the connection to the limbs. But the fact that they saved his legs and give it to him, I don't even know if you can request that.
Stay. Sorry, I couldn't find a sitter.
Okay, wait a second. So there are actually dogs that can go into the hospital. They're basically like companion dog that somebody has to have. They can actually sometimes be admitted to a hospital. Sometimes depends on your hospital.
You all have the flu, but luckily you got here in time.
Doc, this is very important. How long before she can make dinner again?
That's messed up.
Peter, you appear to have a very strong immune system.
Sometimes people will be around a lot of sick individuals and not get sick. I, for myself, right, being that I'm an emergency room doctor, I'm always around people who are sick, and I very rarely ever get sick.
Anyway, this flu season has decimated the hospital and we're severely short-staffed. How would you like to be a male nurse?
Do I get to wear those green pajama clothes all day?
Yes.
Yes.
I'll do it.
So he's going to be a male nurse without any training.
Give me 20 cc's of Music Factory. Clear. Again, clear.
These are your defibrillator paddles, okay? Most hospitals nowadays actually have electrode pads that just stick to the chest instead of paddles, but some places still have the paddles. And if somebody's in cardiac arrest, there's pulseless, and they have a rhythm that is shockable. You don't shock everybody. Typically, there's only two rhythms that you shock. VTAC or VFib when they're pulseless and unconscious. So he did 3 shocks in a row. That is actually an old protocol that's not used anymore. Typically, it's 1 shock CPR for 2 minutes, recheck a rhythm, and then also typically you're using epinephrine at the same time every 2 to 3 minutes.
Lois, I weigh the same 293 pounds today that I weighed in grade school.
You can actually weigh the same amount, but actually have more subcutaneous fat, right? Because fat and muscle weigh different. So you can be 293 pounds of all muscle, but you can also be obese because of the amount of subcutaneous fat that you have and even organ fat that you have.
Perhaps it's this lump on the side of your neck, sir.
Oh my gosh. It's kind of really lateral on the side of his neck. So it could be like an aneurysm. It could be a mass. It could be cancer. It could be a lipoma, which is a fatty tumor.
We gotta go see Dr. Hartman right away. I think it might be a tumor.
Okay, let's have a look. Oh, yes. It appears you have a subcutaneous vestigial twin growing on your neck.
There are things called teratomas that are remnants of hair and teeth that are found in the body, typically in the abdomens, but could be somewhere else in other tissue. But this weird twin that's growing on his neck, unlikely.
Hi, everybody.
What the hell is that?
my God, it's a little me.
That is awesome. Okay, I've never seen this in real life. You would never just go in and just cut this open. You would probably end up starting with a couple different images. You might do an ultrasound, you might do a CT, and then for soft tissue things, you get an MRI. An X-ray is probably useless in this situation. And then once you determine what it is, you may want to open it up and see what potentially is on the inside.
The fertilization device is complete. This will impregnate me with the child that will bring Brian and me back together. First, I add Brian's hair and saliva.
Hair and saliva, good, right? It's got some DNA that you can extrapolate somebody's DNA from.
Yeah, you watch me, bitch.
Gosh. What? You can't just inject straight into the abdomen. There's no place then for the baby to develop. It needs to be inside a womb. And what the womb is, it's the uterus. And typically a uterus is an organ that is in a genetically made woman. Probably unlikely this young boy doesn't have a uterus. I don't know if he does or not, but genetically he shouldn't.
Oh my God, that thing's positive. Is Lois pregnant again? What have you done?
I think you mean, what have we done, Brian? We're pregnant.
Oh my gosh.
Oh my God.
The urine pregnancy test tests for beta HCG or HCG, which is human chorionic gonadotropin hormone. And it's actually most of the time released by the placenta. It could also be released by the pituitary gland, colon, liver. Because sometimes a man can actually test positive in a pregnancy test, but it typically doesn't have to do with pregnancy. It could be concerned for like a different type of cancer. Not too far-fetched that Stewie can potentially test positive on a urine pregnancy test.
You look ridiculous like that.
Too ridiculous for you to put a baby in me.
Okay, Raylene, I'm Dr. Hartman.
Let's see where this actually goes, because Stewie doesn't have the female genitalia.
Her vagina seems to have a penis and 2 testicles.
Oh, right. I sneezed real hard and all that came out.
Ah, that explains it.
He sneezed really hard. It doesn't typically work that way.
Could you do that thing where you take some fluid and tell me if it's going to be an imbecile or a creep?
There's actually procedures that the doctors can do, amniocentesis, to identify things earlier. Typically, they do these to make sure that genetically the baby is okay, that there was not any inborn errors that they would be concerned about, any chromosomal errors, that sort of stuff. There's always a potential risk of causing a miscarriage or infection when you do these procedures, but very, very low, and people typically do them.
Oh my God, what's happening to him?
I'm having a heart attack! You ought to know by now!
If somebody's having a heart attack and they become unconscious, you need to check for a pulse. Heart attack typically means you're having a blocked coronary blood vessel. Cardiac arrest, meaning arrest, no movement, so the heart has stopped. That's when you need to do CPR.
Oh my God. Is my father gonna be okay, Dr. House?
He's in a coma, Mrs. Griffin. Listening to the sound of your voice, I'd say he's the lucky one.
This is Dr. House. So if you guys want me to react to Dr. House, let me know which episodes, which shows that you want me to react to.
Dr. House, if you're gonna save this patient, you'll need this.
Get this thing out of my sight!
Okay, so you know Dr. House. If you've ever seen any of his shows, he just does things the way that he wants to do.
My methods are a little unorthodox, Mr. Griffin, but I think I can help.
What are you doing?
My job. Sometimes people fake being in a coma. This man's not.
Okay, that's funny. We do get a lot of people that actually fake being in comas or fake seizures, but actually as part of our exam, there's something called the Glasgow Coma Scale, and one of it has to do with response to pain. Eyes are closed and you're like, oh, are they just totally unresponsive? You typically do something called a sternal rub, where you actually rub your hand onto the sternum. That hurts a lot. You can push in the nail bed, that hurts a lot. So there's little different areas that cause a lot of pain.
What you talking about, Phyllis?
Oh,
gross. He's getting his nose period.
Peter's references to a nose period is totally inappropriate. People could potentially die from a nosebleed because the nosebleed occurs in 2 different areas of the nose. One's in the front, it's a septum, which is called Kesselbeck's plexus, and the other one is actually a major blood vessel in the back. And if that is open and bleeding, you can actually bleed out because it's so hard to know where the bleeding is coming from, and it's hard to get the bleeding to stop. To stop the nosebleed, pinch the nose, lean forward. Don't push your nose back. There's a type of Afrin, is a name brand, but phenylephrine up the nose. It's a spray to constrict the blood vessels. You can actually still use liquid cocaine. There's liquid cocaine at the hospital, but it's not anything that you would think.
I'm sorry to inform you that Brian has a brain tumor.
Oh no! You can have a tumor in the brain, or actually even like skull fractures that can cause bloody noses as well. That's a lot more serious and dangerous in the sense that now there's a communication between your nose and your brain itself, increased risk for infection.
So, Doc, how much Jamba Juice do I have to drink
he's
to
still
cure
intoxicated.
this? I've also heard that, like, crystals exist?
Crystals work on the idea potentially of healing powers, but most of the time it's probably more related to a placebo effect. Do you use crystals? Let me know in the comments.
But I say we get that tumor out of him right away before he gets any dumber.
So if Brian doesn't have the surgery, will he be all right?
No way. I'm never going back to my old self. Brian could have the surgery and be smart again, or he could skip the surgery and stay dumb like this.
Okay. So the concern is not that Brian will stay dumb. He's not dumb. It's a brain tumor pushing on his brain. It could continue to expand. So you want to address the swelling of the brain, and if there is swelling, it needs to be removed. Sometimes you can give steroids to temporize the problem, but a neurosurgeon needs to evaluate this for surgery sooner than later.
You know what? Hang on. I left my harmonica in the tub.
I think Peter's in there taking a bath.
Yeah, son of a bitch! What the hell did I just sit on?
Where is it? Where's my harmonica? It's not here!
Peter, have you seen Stewie's harmonica? It was in the...
Of course.
Oh my God, it was in the tub, and now it's in my butt!
You know how many times we get in the emergency department, somebody comes in and they sat on something and it went up into a certain area? It's pretty hard just to sit on something. You need to be able to relax the muscle. The sphincter, which is the muscle around your butthole, it's tight.
Stewie, Daddy needs your tiny hands for a very special project.
Tiny hand. Oh my gosh. You can attempt to get it out. It is very painful. Sometimes you can get it out in the emergency department. Sometimes you actually have to go to the operating room. At the hospital, there's the harmonica. We do get x-rays looking for alignment, looking to see how far up it is with the orientation, those sorts of things. If it's too far up to where you can't reach it with your hand, you have to go to the operating room. Or worst case, they have to actually open you up.
Can we address my husband's situation?
Well, the harmonica's up there pretty good. Unfortunately, removing it would require a very expensive surgery that's not covered by your TGI Fridays gift card.
Oh my gosh. Potentially an emergency because of risk of bowel perforation, but a harmonica could get snagged, can cut.
I don't know. But suddenly it smells like John Popper in here.
That was me. I got musical farts. Holy crap.
Holy crap.
I will not allow this opportunity to go to waste.
Don't put anything up there, like I always say, without a string or a big flange.
We should start by checking your reflexes.
That is not what you mean by checking your reflexes, okay? Checking your reflexes, your DTRs, your deep tendon reflexes. That's when the doctor used the hammer. The classic places like the knee, the patella tendon. You can even do it on the forearm, for the wrist as well, but not just trying to scare somebody.
But you gotta help me. My arm really hurts. It all started after I got a chainsaw.
Is that right? Well, it sounds to me like you may have chainsaw elbow.
Okay, no, there's no such thing as chainsaw elbow. What they're describing most likely is tennis elbow or golfer's elbow, which is medial or lateral epicondylitis, which is just inflammation of the tendons in those anatomical positions.
Chainsaw elbow?
So how much synthetic opioid do you need?
That is so messed up. Basically, the best medication for this would be an anti-inflammatory, which is ibuprofen. Opiates in this setting just covers up the pain and actually doesn't fix the problem.
I'm trying to prescribe enough to earn a fanny pack.
I don't have any specific medication, brand, generic versus trade. I think the only thing nowadays that pharmaceutical companies actually end up doing is educational teachings with maybe a dinner or something like that.
Have you ever had a chiropractic adjustment?
What's that?
It's a procedure where a guy who couldn't get into medical school tries to rip your head off.
That's messed up. So chiropractors are their own specialty. They not just crack or realign people. They also do wellness and health optimization. They go to school for a long time as well. They chose this career. They did not make it into med school.
It's kind of like the Polar Express.
Let's do it.
Okay, I'll give it a shot. But this type of thing is usually done in strip malls next to a Little Caesars.
Unless he was trained on a separate course that he took on his own, he shouldn't be doing this. He needs to know these techniques. We spend many, many, many hours learning how to do this. Oh gosh. Oh my gosh. Oh, that's not how you do that. Horrible.
Holy crap, what happened?
Well, I think we simply found your true height.
Okay. So you can actually do cervical decompression basically by pulling on somebody's head, by lengthening it. So it takes some of the pressure off where the nerves are coming out, which could be causing compression of the nerve, which then can be causing symptoms to your extremities and your pain and that sort of thing.
Got you now, bat day.
Okay. So bats could carry rabies, okay? And their bite is so sharp that you may not even notice it if you're sleeping.
What is it? Ah!
Oh! There's always the potential that they might have bit you. The concern, though, is it could, and if you get rabies, it's pretty much deadly. What ends up happening is you would go to the emergency department, and if you know where you got bit, you can get immunoglobulin to protect you, and then you would also get the rabies vaccines.
Peter, what the hell did you do to Stewie's hand? It could be broken.
Oh, no.
I didn't mean to.
You're trying to hit the bat.
Sometimes I don't think before I act.
Stewie needs an x-ray of his hand to see if there's a fracture, and then we did see some blood, so is there a laceration that needs to be repaired?
Good news. Stewie's hand looks fine.
Oh, hey, high five.
And in kids, depending on their age, not all of their joints are totally formed, so there's a lot of cartilage that is still there that you can't see on an x-ray that it will future form into a bone.
Stewie hasn't had his vaccinations yet. Should we take care of that?
Well, I suppose so.
Oh, but first, I'm required to have you read this pamphlet about the risks of vaccinations.
Possible side effects: fever, severe allergic reaction, muscle and joint pain. Wait, and this can't be right.
A lot of good things about vaccines. Vaccines are not without risk, okay? There's always a chance of something happening. Every human is different. We all have potential different reactions, but risk versus benefit.
Hey, man, how many questions your lady asked?
Oh, geez.
Million?
But I don't remember having to read any of this when Chris and Meg had their vaccinations.
Well, that was before internet chat rooms made everybody an expert.
Well, okay, so that was a big dive into vaccinations, especially now what's going on in the world. So vaccinations are a good thing. Vaccines have been developed to help eradicate a lot of different viral issues that we've had in the past.
What are you boys doing up there? Get off the roof!
Go back in the house, Lois. We're being jackass. Okay, ready?
All right, we're rolling.
I'm Peter Griffin, and this is Shopping Cart Roof. Roof Shopping Cart.
Nice.
Okay, go!
Oh!
Ow! Ow!
Oh, broken back. Oh!
God, are you okay?
Oh.
I don't know. What does it look like? What do I do?
Don't do anything.
What is that? What did I feel, Chuck?
That's your neck.
Fine, dude.
Oh my gosh.
Picked up a bunch of notches.
I'm scared. I'm scared.
my gosh.
I'm scared.
Upper cervicals typically have to do with your arms, right, and your neck. Both are moving. They're moving well. Probably hasn't caused any neurologic problem. It's more structural problem. This is hilarious. I obviously never seen this unless the head is decapitated off. It almost looks like an internal type decapitation.
I'm scared.
Oh, and it just vomited everywhere. It's so gross. Pain, anxiety, these things can cause vomiting. You see it very often.
Does this get fixed with ice or heat?
Ice now, heat later.
That's true. Ice or heat, right? So in this circumstance, though, heat or ice, drop both, get to the hospital, get to the emergency department ASAP, like 911, get in the car ASAP, and get seen immediately. You need a neurosurgeon, you need an orthopedic surgeon, you need a trauma surgeon, you need an ER doctor. All of these docs will show up and really work together to figure out how we're going to put this neck back together and make sure that there's no other major injury that's going on.
What are you, nuts? I got no special
We're at a bar.
talents. Well, what can I do that nobody else does?
Well, you just ate my tip.
Oh.
I got it.
What is he going to do? What is he going to do? All right.
Oh my God, Lois! I can't see!
Uh-oh. So a lot of times when I've seen patients where they literally just can't see, it's actually due to diabetes or sometimes brain tumors. So definitely needs to be seen.
How about now?
Nope, nothing.
Well, that makes me feel much better. You can't see the spaceship either. My cousin Marshall
Oh my
insists
gosh.
if you look past the picture, you can see us.
Normally you'd use an eye chart, but even then, if you can't see the letters in the eye chart, then you use big objects, then you check if you can see waving objects, and then can you see light or not.
Can you please just tell tell us what's wrong with my husband?
Oh, yes. Well, you see, after ingesting such a large number of metal coins, Mr. Griffin appears to have succumbed to nickel poisoning, causing him to lose his sight.
Oh my God, Lois, I'm blind as a bat. I can't see a damn thing.
The likelihood that the nickel from the nickel is causing blindness is pretty rare. It causes a lot of other things, more GI symptoms, skin symptoms, maybe some neurologic things, but it doesn't typically cause eye blindness. Some other toxicities could.
You're getting your tubes tied.
Why should I get my tubes tied? You should get a vasectomy.
First of all, I don't know what that is. And
Yes.
second of all, no freaking way.
Tubes tied, so what they're meaning is the fallopian tubes do a tubal ligation, blocking off the tube, then there's a chance that you won't get pregnant. So it's like 99.9%, but it's a big procedure versus a vasectomy is basically you're doing a very similar procedure where you're cutting off the tubing from where the sperm leaves to get mixed in with the semen. So that way now you don't have any swimmers in there, but you still have ejaculate. It's an easy procedure. It's outpatient. It's a lot more, I would say, gentle per se.
It's actually a lot quicker and safer. Let these guys explain.
Thank you, Brian.
Vasectomy's a medical procedure. One that makes you
This is awkward.
man. You're half a man.
Doesn't make you half a man. Still make sperm, but they don't get ejaculated out. So you can still climax, still have an orgasm, all that stuff.
Just come out whenever you're done.
Oh God, oh God, oh God, oh God, oh God, oh God.
Oh, that's disgusting.
Oh God, I think I feel them moving.
All those samples are now contaminated. Not sure if Peter has already had a vasectomy or he's getting checked. If you have a vasectomy, you then need to provide a semen sample. It could take a little bit, a month, 2 months, 3 months. There could still be a little residual sperm coming through.
Hi, my partner and I want to have a baby. We'd like a vial of sperm and an applicator that looks like Jodie Foster's knuckles.
Certainly. Let me just go to the freezer. Mr.
That's
Griffin,
horrible.
you were in there an awfully long time. Are you all right?
Yep, fine. And just so you know, everything in there is exactly the way it was when I went in. There is absolutely zero chance that I spilled all the jars and had to refill them with my own sperm.
What? That is disgusting. Oh my gosh. You know, our bodies actually aren't made to be able to produce that much. And there's actually an absolute refractory period in men to where you actually cannot ejaculate again in such a short period of time.
Okay, Mrs. Griffin, tell me what you see.
I see a cow in a lab coat, some vultures in a cowboy hat, and a dog trying to trick a cat into a clothes dryer.
Just as I thought. You're far-sighted.
Ba-boom. Doing your visual acuity test. You can do a shape, letters, but typically it's not images and it's a certain distance away. And we know how good this doctor is.
I would say you either need to get glasses or maybe LASIK.
Is that the surgery people get and then tell everybody they got it?
Yes, it's the veganism of elective surgery.
Yeah. That is so true. You'll definitely know if somebody's ever had LASIK before because they'll tell you. But they're super excited about it. They have better sight, so why wouldn't they want to share it? There's LASIK, there's PRK, there's other type of different surgeries, but it's all related to the cornea itself, actually changing potential thickness of your cornea, which then has to do with how well you're seeing.
If you're unsure of what to do, here's a video of Radiohead frontman and super weirdo Tom York to help you decide.
Not many people know that I'm blind in one eye. Can you guess which one?
Fine, I'll get the LASIK.
Great. Make an appointment with my nurse. Now here's a lollipop from the Sackler family that says, Sorry.
I think this doctor's a general doctor, family medicine doctor. This doctor does not perform eye surgery unless it's an ophthalmologist. And then the whole Sackler reference, so I'm not sure if everybody understands, but Sackler family owns Purdue Pharma. Purdue Pharma has to do with producing opiates and almost being sued by every single state in the United States for having their hand in, producing the opiate epidemic. Per se.
Mrs. Griffin, the surgery was a success. And by that I mean the hospital agreed to take your Discover card.
Plus, we'll get 1% of that back, which is basically like getting nothing.
Oh my gosh. Obviously ripping on the hospital because you have to pay for the services, especially in the United States. But in other countries, sometimes you don't have to do that. And it's just services are available and are free of charge or paid in your taxes that you paid, all that stuff. Bandages are off. And the clarity of vision is...
Oh my God.
She can't see.
I'm blind.
What?
But you can still see, like, the stove and laundry, right?
So listen, disabling vision loss where you're like seeing black is very, very rare in LASIK surgeries.
Hey, what do you got there, Peter?
Rice cakes? Never had one, but somebody told me this is a really good way to start your diet.
Rice cakes are fine, it's a source of carbohydrates, and it is a good way to help get your diet going, to help lose some weight, and to kind of manage how you get your carbohydrates in and your different calories in your body.
Who could think of such a horrible thing?
So dramatic.
Peter, I don't understand why we have to drive all the way to Ohio to ride a stupid roller coaster.
Yeah, besides, they're still not going to let you on. You haven't actually lost any weight.
Oh, I think my live figure would suggest otherwise.
He's wearing a corset. Didn't lose weight, just displaced it in a different area. We actually have these different types of braces as well. They're called TLSO braces, where it's thoracic lumbar sacrum, a piece of plastic to keep you from shifting if you fracture one of the vertebrae in your back. Historically, corsets are made to tighten everything up. Today, instead, people are more using like waist trainers.
A girdle is not a substitute for weight loss, Peter.
Hey, I'm riding that roller coaster, and that's all there is to it. Now let's get out of here. This thing's squishing my organs around.
First off, it's not squishing your organs. It doesn't squeeze your organs out, especially your heart is protected by your rib cage. So squeezing your belly is not going to squeeze it up. Could your stomach slide up from a hiatal hernia? Yes, that could be possible, and it can go into your chest cavity and displace your lung to the side. Not necessarily going to come out your mouth.
Yeah, come on, Quagmire. Get the hair transplant. Come back to us.
You're right. This isn't me. Baldness is for women's crotches, not men's heads.
There you go. That's pretty close.
Hair transplants are a thing. You can take good hair and you put it back on the head, but I have seen a lot of people fail where they have like this huge big strip of hair missing in their back and they're bald on top. Now you can also take medications to try to keep your hair before you lose it.
Glenn Quagmire? Why does that name sound familiar? Oh, yeah, I treated you for butt flu.
Hey, you want to keep it down?
I don't really know what butt flu is. It's not a diagnosis that I've used, and it's not an ICD-10 code. Maybe it's like diarrhea or something like that. But flu in general, body aches, it's a viral illness, cough, runny nose, those sorts of things. So of the butt, is that what they're trying to reference? It's not a thing.
How's it going, Dr. Kamada? Bob. Matei. Jim. Marion.
Yeah, that's not good.
Jeez, Joe.
Yeah, I come here a lot.
As everybody has told me, Joe didn't get paralyzed from a spinal injury. His legs got all shot up. So he's probably had multiple surgeries, had to go to the hospital a lot. And over time, you actually develop relationships with the people that you are there with and that are helping you recover.
I now declare this hair transplant officially over.
What?
Hey!
What is this doctor? I've seen him do LASIK surgery earlier today. Now he's doing hair transplants. No, these are doctors of these different surgeries are specialists, not general practitioners.
Hey, he's back!
You look great, Quagmire.
Oh, my God. One of my patients on 2 has been shot.
Oh my God. But now he's got a GSW upstairs, shot through the floor. And then it's a trauma. You know, at the trauma hospitals that I work at, if you're shot in certain areas, hand or below your knee, and it's just soft tissue wound, you're not even in trauma activation. Wound care and follow-up.
I call it Peter Griffin's bunker busting mega ultra super.
Oh! This is literally my life. People who come in with no fingers, their hand is gone, exploded off, arms gone. We gotta think, we gotta be safe. Please don't do this. If this does happen, grab whatever tissue you can find. If you see fingers laying around, limbs laying around, grab them, go to the hospital, get there as quick as you can.
What happened? Oh my God!
You know, no huge hurry, but I'm sort of out of juice over here.
There's one of Dad's fingers.
We have to hurry.
Grab the fingers.
Pathology, if you get them back soon enough, they can be reattached.
Yes and no. So the issue with fingers is you need to reattach the blood supply and the nerve supply. You can sew the tissue back together, but you have to have a good blood supply to make sure it has nutrients, that it just doesn't die off. So that's one major issue, and there's such small blood vessels. And then it's a horribly dirty wound. Bring everything in. If you have a bleeding injury, laceration, amputation, pressure dressing to the area, and if that doesn't control it, at that point you may need to use a tourniquet if it's life-threatening bleeding.
Hey, there's one of them.
Peter, look out!
Oh! Peter's having a bad day. What do you do with the amputated piece? What you should do, don't put it directly on ice. You actually want to either put that in a plastic bag or like a wet gauze or a wet tissue around it. Put that in like a water ice bag itself. And that way it stays cold. It slows down the processes of the tissue to give it its best chance to get reattached later.
Next is the Brown family. Oh, my goodness. I'm so sorry. Sometimes I write descriptions of my patients to help me remember them.
No, it's okay. Our last name is Brown.
Dr. Hartman, what are you doing, buddy? Like saying things like that out loud. Like, okay, sometimes we have little triggers that help us remember things using patient identifiers relating to skin color or any other physical identifier should be used. If he's referring to the Brown family, then that would be accurate. Let's see where this goes, Dr. Hartman.
Oh, okay. Phew. Then this must be Chubster Dum Dum.
What? Chubster Dum Dum. Totally inappropriate. And don't say that out loud. That's not cool. The kid obviously is a little overweight. Don't call somebody out about that after they've had like injuries. You have a discussion about their weight if they need to have a discussion about their weight.
I'm sorry, sir. No visitors.
Excuse me, I'll have you know I'm the shooter. So, how's he doing?
How's he doing? How do you think he's
What did he
doing?
do?
You shot my son.
So actually in the hospital, when somebody actually comes in to the trauma center who's a gunshot victim, they're actually not identified. The people taking care of them will know their name, but on the board or for visitors, the names are left off. So you can't actually identify who the person is, because if this was like somebody trying to kill somebody, they potentially would try to get into the hospital and try to finish the job.
Calm down. I want this racist out the room, and I want him arrested.
Racist? I put these gloves on.
I've had patients come in and they put their hand out to me and literally you can see feces in their fingernails. Like, this is not a joke. Like, it does happen.
Wow, I really messed up. I
Yeah,
haven't
you
felt
did,
this
Peter.
bad since I drove by that speed sign.
Oh, whoa. Seriously? We see in the emergency department car accidents all the time. We see people who have delayed extractions because of bent metal that the fire departments had to cut open with, like, say, the jaws of life. And we see tons of injuries where, like, ranging from concussions to lacerations to fractures to amputations. We got Peter's car accident. That car accident definitely doesn't look survivable. It's flipping multiple times, destruction of the car, as well as it's on fire. By the time somebody gets down there, if he can't get out of the car, he's probably gonna die.
Sorry, I just prefer to do number 2 at home. Where were we?
I'm just gonna say this because I'm gonna say it. He talked about going to the bathroom. If you feel the urge, you need to go to the bathroom, please go to the bathroom. Don't try to suck it back up in there and wait for another time to go, because you're gonna be behind in the amount of poops you're gonna have. You're gonna increase your risk of diverticulosis, which then future increase your risk of diverticulitis and perforated bowel.
It's Stewie, Dr. Hartman. He's having trouble focusing at school.
Ah, yes. So you're telling me your baby won't sit still in a way that's convenient for his teacher?
Yes.
I'd heard stories, but never thought I'd see it with my own eyes.
Babies crawl, babies move around, babies don't really listen. I don't know how old this kid is, but if he's acting like a normal child, he should be moving around.
I'm going to write Stewie a prescription for ADHD medication.
Oh my gosh.
I don't know. Doesn't that stuff make you wired?
Come on, doctor. Like, what the heck? You're trying to prescribe a stimulant to an overactive person who's highly stimulated. Obviously, it works for some people because that's why we have the medication. Our first go-to as healthcare providers and teachers and parents should be to address the problem and try to figure out from behavior modifications to get the kid to focus or figure out why the kid's not focusing before jumping to drugs as your first line of treatment.
Well, if you're low energy and lethargic, yes. But if you're high energy, it actually calms you down and helps you focus. At least that's what I'm reading on WebMD. A lot of different kinds of medicines.
There's a cat in here.
Okay, I guess we can give it a try.
Here you go. Now, who's this little guy?
Oh my god. The doctor's not even like paying attention. He's looking up things online. Obviously, sometimes you have to look up dosing, when to start a med. That's okay. Obviously, doing it in front of the patient, like, fine if you're having a good open relationship with them.
We're late.
Whoa, Peter.
What the hell?
Why does he look so
Peter, it's
sunken?
horrible.
Other people live here. Oh my God! How did this happen?
It's from smoking.
Not that bad.
Peter, you can't live like this.
If someone's been smoking for a long time, it's messing with the vocal cord, so you can actually hear it in their voice. And then their skin, it's like tight, leathery, wrinkled. You can tell. When you stop smoking, it'll take a very, very, very long time to get back to normal.
Dr. Hartman, we're here for you to help Peter quit smoking.
Mrs. Griffin, I can't do that. It's an addiction.
Well, there are multiple ways to actually stop smoking. He's calling it an addiction. It's more typically like a habit. You could be addicted to the process of smoking, going outside, taking a break. You could be addicted to the nicotine.
He's killing himself.
Ugh. All right, how many Vicodins for you guys to just leave me alone?
Oh my gosh. Wow. He's just like, well, let me just give you some Vicodins. We have an opiate crisis in the United States and around the world. Not something that you should replace it. But it's pretty crazy because opiates in itself affect a part of your brain that have to do with serotonin and dopamine, leading to anxiety, depression, which is part of also the reward feedback system related to also smoking cigarettes. People might actually feel better, but it's a totally inappropriate way to treat somebody trying to get off of an addiction.
Well, it's too bad Dr. Hartman couldn't help us. I guess we should go to the Stop Smoking Clinic and then maybe get a couple bottles of wine.
Oh my gosh. Some people have personalities that are addicted. There are multiple things that you can do to stop smoking. You can do Nicorette gum, you can do lozenges, you can do a medication, and then there's also the idea of nicotine cartridges if you do vape to slowly decrease the dose of how much nicotine you're getting.
Check out how hot my last patient was.
Oh my gosh, totally inappropriate. Like, this is so disturbing. I have my phone in my pocket to get phone calls from the hospital. I occasionally, with the consent of a patient, take a photo of maybe an injury that I can send to a specialist so they know the injury, and it's all no patient identifiers. It's via an encrypted program, and that's only if we have to do it.
According to this projection, Stewie's adult height will be 5'1".
What?
5'1"?
You go to the doctor's offices, you potentially can get a prediction of your height. Obviously, this is not something that is highly scientifically accurate because things can change. Growth plates can stay open longer, they can close sooner. Sometimes you can get an x-ray and it'll show your growth plates are still open when you're a little bit older and be like, oh, I'm actually still growing.
I mean, I suppose it's fine if he's gonna die at 14. Is there anything on there about that?
Well, we learned in medical school that the short ones do go faster because they smell more farts than the rest of us.
Oh my gosh. That actually is kind of funny, but totally not true. Actually, longevity studies have shown smaller people in general, not massive bodybuilders, but people who are just smaller in general, will actually live longer. And it potentially has to do with if you're larger, you're asking your body to work harder and almost do double the work as somebody who's half your size.
This is terrible! I can't be short! I'll be an outcast like Rudolph the uncircumcised reindeer!
What? Rudolph the uncircumcised reindeer? I've never heard of such things.
All right, it's Dasher. He's been complaining, and he is the one who has to look at her.
I don't know. Mrs. Claus says it'll decrease my sensitivity.
Oh my
I'm
gosh.
sorry, why are you talking to my wife about this?
Yes, by being circumcised, it does decrease sensitivity a little bit. Your higher chances of having an infection with an uncircumcised penis because you can get bacteria trapped underneath. If you don't clean it well, then you increase your risk of phimosis and paraphimosis. So there are multiple reasons why one would want to circumcise himself, not just because somebody has to look at it.
Well, I got the results of your ultrasound, and I got some news for you.
Wait. We don't want to know if it's a boy or a girl.
Oh, okay.
Typically, to find out the sex is done in the second trimester.
Well, it's not breathing.
Oh my gosh. He says the baby's not breathing. So the baby's inside of a human being attached by the umbilical cord, swallowing the amniotic fluid and breathing in the amniotic fluid. And what's super cool is actually there's holes in our heart, foramen ovale, so blood kind of bypasses different parts of the heart because the lungs aren't being used to oxygenate tissue. It's amazing.
Give your dog something to post on Facebook!
All right, and nobody's blocking.
Oh!
Back off! He may have a concussion!
A concussion?
You do me an honor, Lieutenant.
If you're playing a sport and you suffer a head injury, or you're around somebody who suffers a head injury and say a sport like football, don't immediately rush to take the helmet off, protecting the head. If you do have to take the helmet off, there are different steps that you need to do, and typically athletic trainers will know, or EMTs will know, how to take that off in a field setting.
Hey, Stewie. How's our little concussion guy?
Oh no! Oh no! What has he got? He's got anisocoria, unequal pupils. That needs to be evaluated immediately at the hospital. So go get it checked out and get a CAT scan of your brain, please. And obviously he's like sleepy, tired. He should get checked out anyway.
Is anybody gonna answer that telephone?
He keeps thinking the phone is ringing, Brian.
You can have nerve injuries of the ear. So there are a lot of different reasons why you could have ringing in the ears, and he's hallucinating, he's hearing things, he's seeing things. This kid needs to go to the hospital.
Well, at least he's talking again. I think that means he's getting better.
Well, on TV, if somebody gets hit on the head, you hit him a second time, and that gets him back to normal.
No, Chris, this is very serious.
Yes.
You see, what a concussion is the impact of brain matter on the inside of the skull. But you can't make a helmet for the inside. Chris, are you crazy?
Shh, let's just let him sleep this off.
No, you do not let him sleep it off because there could be bleeding going on in the brain. Everything gets sloshed back and forth. Your brain can move and smack the skull on the inside, could cause ripping of your bridging veins.
It's just that when you've read as many books as I have, it takes a toll, you know?
You sure it's not from watching too much close-up porn on your phone?
You know, I wouldn't be surprised if they have that now.
You're so full of it. You don't need those things.
Wait, who said that?
Definitely knew people back in the day that would actually wear glasses without any prescriptions in them. Yes, you can strain your eyes, or your eyes can get tired, and sometimes an optometrist will give you eyeglasses to help with that. As you get a little bit older, sometimes you need glasses because your eyes won't accommodate, and it's something called presbyopia. When things get closer or further away, will the lens actually get larger or smaller? It loses that ability. Oh gosh. Oh gosh.
Hey, Bri?
Yeah?
Oh,
Damn it!
no!
Ah, there's glass in my eye! Oh, son of a...
Do not take any baseball bats to anybody's skull. Skull fractures, intracranial bleeding, epidural hematomas, subdural hematoma, death. A baseball bat is for hitting baseballs. Definitely see eye injuries at the hospital. Most of the time, foreign bodies get in there. Usually people are either welding or using something small, metal-wise, and a piece of metal actually goes in the eye. There's a little piece of equipment that we use called a burr, which actually spins really, really fast, and you can actually spin it out, so to speak. Definitely want to look in all areas of the eye, wash out the eye.
Subject wanted for medical... What's that?
Experiments.
Asparagus.
All right, Mr. Griffin. At this time, we're going to inject you with what we believe we've isolated as the gay gene.
I don't understand.
Well, if we're correct, we will have successfully proven that homosexuality is genetic and not a matter of choice or environment.
Does that experiment actually exist? I have no idea. There's multiple factors, multiple components to our own sexualities. That's a whole other topic. In my opinion, maybe we should be doing research and scientific studies on things that actually maybe kill people, like cancer. But this is Family Guy, so it's a little obscure and a little off. Oh my gosh.
So how
Come
the medical
on.
experiments go?
So good, Lois. So good.
So
squeeze right in here if my
The
thighs will let
stereotypes
me.
of the Family Guy. Bad stereotypes, that's a potentially small subset of people who are homosexual or heterosexual, asexual. It doesn't matter what you wear or how you behave. Oh, Family Guy.
How many boogies would you say you consume in a week?
Oh, God, maybe like 1, maybe 2 during the holidays, maybe?
Who eats their own boogers? That's disgusting. I mean, who doesn't enjoy picking a good booger? That's a different story. But you have to be careful. Dirty fingers, dirty nails, increase your risk of infection into the nose. And your nose is actually doing what it's supposed to do. It's filtering the air for you. Typically use a tissue, blow your nose. Try not to eat it. There is no health benefit to eating boogers.
Stewie, I'm your doctor. I can tell just by looking at you that you're eating more than that.
I'm sorry. I've just been so nervous about these test results.
Well, that's
So
understandable.
often, we'll ask patients different questions. Maybe how much alcohol do you drink? And you get once a week. You multiply that by 3 or 4. People will want to give us an answer that's maybe partial truth, maybe not to look so bad. The doctor only cares about your health. The only way for us to truly help you is to understand what's going on inside your body. I'm not judging you. My colleagues are not judging you. Just tell us the truth.
You can't handle the truth.
So we can treat you properly.
Seeing as how you did test positive for cooties.
That's terrible!
I think you need to get your affairs.
He's got the cooties and get your affairs in order. The world is ending for preschool.
I don't have any affairs. I'm 1.
Well, then you're ready to die.
Officially, cooties. I don't think is actually an ICD-10 code. I don't think it's an official diagnosis. But is it just trying to say you got germs? Maybe. Cooties isn't really a real thing.
I got your meds, honey.
Who was that?
That's my 20-year-old nurse.
He's wearing homemade sandals.
Yeah, he has no medical training.
Having companionship will actually make people feel better. They actually have shown studies that if you have an animal, typically are felt more love and more happy, and then that translates into better health.
This is the Flintstones cocktail I have to take every day. 17 Barneys, 18 Wilmers. I have to take the Bam Bams just to keep things moving. Does this seem dramatic to you?
I'm only laughing because I grew up with my friends always having Flintstone vitamins at their house, and they taste like candy. Sometimes when people get terminal diseases, they actually have a quick switch of the way they look at life. But as far as I know, cooties are not terminal and they're not contagious. There's a ton of alternative therapies out there, and they all have their place. I think traditional medicine mixed in with some holistic type approaches is actually more beneficial than just one by itself.
Oh my God, what happened to your face?
Oh man!
Stewie? Hello? Who's there? Sorry, Brian, my
You can't even
eyes
see
don't
anything.
close when I sleep, and I'm blind for a few seconds when I first wake up.
Stewie, you got more plastic surgery?
I know, it was a mistake.
I told you not to do this. You're way too young to be getting plastic surgery.
Yeah, 1-year-old. Oh my gosh.
I think one of the cuts got too close to my brain. Brian, school pictures are in 2 days. What am I going to do?
So the question, what do you have done? It looks like you got lip filler, face pulled back, and then probably some Botox in there, but he can't close his eyes. Typically, if you actually get Botox near your eyes, your eyelids, it'll probably cause them to be droopy because there's no muscle tension. And if it does happen, it will go away. And maybe babies shouldn't be getting Botox or fillers.
He needs you to help fix his face. Oh, absolutely, I can do that. Great. Is it a simple procedure? Oh, sure. We just break every bone in his face and then smush him back into position.
Oh my gosh.
Dr. Hartman, where'd you get your medical degree from?
He told me bed rest and ice packs for 2 days so it can set, but I'm not missing picture day.
2, 3.
Oh! I don't know what kind of procedure that was. Did he break his bone and try to smush everything back together and rip the seams? Horrible. I didn't mean to say facial droop in this capacity. There's a lot of connective tissue underneath the skin. So yes, if something kind of rips open, lacerates open, everything else is still intact. It all just doesn't fall off. Please be careful with injections, fillers, all these different things. Go to a reputable place. Go to a sound place. Don't go to the place that's the cheapest or the best deal, because sometimes you get a bad deal.
I never told you this, but for years now, I've been planning on retiring at 45 so I can work on finding a cure for Alzheimer's disease.
Alzheimer's disease. Alzheimer's disease is not a disease, but I'm assuming it's related to forgetting your testicles.
Peanut, are those testicles? Where did you get those?
I don't remember.
You got Alzheimer's disease, which is a type of dementia. Dementia is basically slowly losing your memory, not able to form new memories. There's multiple different kinds. Oh, he's in the hospital. First glance, these injuries are related to either car accident, a fight, riding a bicycle or a skateboard or a scooter, and he fell and hit his face. Those are kind of the first things that you think of.
Mrs. Griffin, I have some good news or some bad news, depending on how you feel about your husband. Do you love your husband?
Yes.
Mrs. Griffin, I have some bad news. Your husband is brain dead.
We don't present things this way. You don't say good news, bad news. You just say this is what we found.
I'm afraid it's time for you to make your choice.
Make your choice?
Are you telling me I should pull the plug?
I'm afraid so.
Typically, if there's no brain function, then you actually wouldn't have the function to breathe. So you should probably be on a ventilator. Pulling the plug basically means turning off the mechanical ventilation. If their brain isn't functioning to tell them to breathe, they will die pretty quickly right after that.
Also, you might be getting a call about the service you received here today. Do you feel I've earned all 10s?
We, as physicians, are judged by the government based on surveys that patients do. It's called a Prostate score in the emergency department. Do we address all the concerns? Did we address your pain? Basically, just hits the things that we should do.
I don't want to go. Hey,
Hey.
that's a plug. You pulled the plug on me?
Oh, what? Oh, man, Lois. Actually, sometimes things like this happen. Usually, it's from GHB, the drug which people become totally unconscious, and then once it's metabolized out of their system, they just all of a sudden wake up. They rip their endotracheal tubes out.
Peanut, it was a very difficult decision.
How could you do that? I'm alive.
I'm here from the mortgage company. Mr. Griffin, you're 3 months late on your payment.
So that is a tough conversation to have. That flatline noise that you hear in movies is most of the time just a fake idea. You hear the bloop, bloop, bloop. We don't hear those at the hospital either. It would just be a ton of different noises all over the place. He's got a pulse ox monitor on his fingers, and he's got an IV in his right arm in the antecubital fossa, so good job. At the hospital, obviously. Lois, you're freaking out.
Don't worry, Lois. I went blind a while back.
Oh.
It was cool.
Dr. Hartman, you said there was very little risk to LASIK, but now I am blind.
So Lois is blind after eye surgery. Sometimes you can have a lot of edema and swelling to the eye itself, so that can cause temporary blindness. At that point, anytime there's blindness, phone call to an ophthalmologist, potentially get a CT scan of the head to make sure there's no mass or no injuries, and then the ophthalmologist needs to see these patients.
Okay, look, this isn't my fault. It was take your cat to work day.
I love that the laser the cat was using to run around and try to get. So you wouldn't do it freehand like that. Animals in the hospital, yeah, that doesn't happen. We do have in certain hospitals therapy dogs, but not a random bring your animal to work day.
Get that cat out of here.
They're not sterile, they're dirty.
Until she gets used to her new life, you'll need to take care of her. Feed her, bathe her, drive her places.
They're gone, aren't they?
They left, yes.
Wow. There are times when we see family dump their member into the emergency department and we can't contact them, and then we have to figure out what to do with these individuals, and then that's when you actually get law enforcement involved.
Sorry to keep you. I was reading this Highlights magazine in the waiting room.
Oh my gosh, I remember those Highlight magazines. We got some little baby x-rays up there. We got a sternal notch all the way down to the pelvis.
Dr. Hartman, were you able to tell anything from Stewie's x-rays?
Oh, yeah. Little guy's got scoliosis.
Oh my God.
Scoliosis is basically lateral angulation of the spine. You can actually just do an exam where you put your feet together, you bend forward. The ribs basically will then rotate one way or the other. So that is one way to do a quick assessment for scoliosis.
Oh no, am I going to be a big shoe, small shoe guy?
This doesn't typically have to do with leg length discrepancies. It could a little bit if you're having pelvic shifting. You need to build up a shoe. A big difference versus like, do you need a little lift in your shoe? Those sorts of things.
But don't worry, he'll be fine. He just needs to wear this brace for a while to correct it.
Oh, dear.
Now, does he have any school pictures coming up?
Yeah, he actually does.
Well, then this will not be a refrigerator door year.
The braces that we use at the hospital that I see are something called a TLSO brace, and it has to do with the different areas of your spine. Typically, it's used when there's like a fracture versus misalignment.
What the deuce?
Uh-oh. Yeah! Oh my God. He has such a massive head that the sound of his head hitting the stairs is actually a really good job.
It's got to be from wearing that damn brace all the time. Your neck must have atrophied so much it can no longer support your head.
There you go. We do tell people with the soft cervical collars not to put those on because you can actually cause muscle stiffness and potential atrophy. Say you have a shoulder sling. You got to make sure you take it out of there and do gentle movements. If you use it all the time, you can actually cause yourself frozen shoulder syndrome.
You've got to take me to the hospital. Absolutely. Let me just watch Jennifer's body and we'll go right there.
If you have neck laxity or you injure your neck, make sure you stabilize it. Wrap a towel at your house and roll it up and put it into almost like a horseshoe and put it in that area. You can tape the front. What the heck? What the heck?
God.
Having a heart attack?
Chris is having a heart attack.
We're not supposed to leave the table.
Chris is having a heart attack. Isn't Chris like a kid? It's not impossible to have a heart attack at a young age. Typically, it's due to like a congenital issue. More commonly, it's like 40s, 50s, and 60s is when bad cardiovascular disease starts kicking in.
You almost worked yourself right into the ground, buddy.
Oh, it's all our fault. We never should have let you take on the pressure of being an adult.
It's okay, Mom. Boy, I thought being a grown-up would be easier than being a kid. But it turned out it was just as hard.
Heart attack, in general, is defined as a ruptured plaque that causes a blockage and the heart can stop or go into a cardiac arrhythmia. If he doesn't have plaque development, he shouldn't be having a heart attack, but you can actually have something that has to do with broken heart syndrome, which could present as a heart attack.
I guess what we all learned is that no matter who you are or where you come from, life is a terrible thing.
No, it's not. Life is what you make of it. But on the flip side, stress is a real thing, and it really does affect our bodies and our mental state and physical state.
All right, we're just going to take a quick cap smear.
Don't you
Pap
mean
smear?
pap smear?
No, at this hospital, we obtained the sample using beloved British comic strip roustabout, Andy Cap.
Oh my gosh. I've never seen this or heard this episode. What the heck?
Hello, love. Let's have a smear.
What? Anybody having this type of exam will tell you it is awful. They're both male, so nowadays you actually have a female chaperone in the room.
I'm not letting you do that. You can't even see.
That's all right, bird. I goes by smell.
The emergency department has a plethora of abnormal smells. This schnoz right here has the ability to pick up a lot of different smells. The smell of marijuana or the smell of regular alcohol versus metabolized alcohol. We have the ability to just like pick up these smells just because we're around them so often.
Good morning. Are you ready to sweat?
I woke up sweating.
Okay.
Yes! If you are sweating in the middle of the night, one, you could be having an infection and you're breaking a fever. But the other thing you worry about with night sweats is tuberculosis. The occasional night sweat is fine, but something that becomes more persistent with other symptoms, just something to think about and discuss with your healthcare provider.
Check that it's covered by your healthcare provider!
Ow! 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 My balls!
What is he doing?
No, the other ones. Ow! Ow!
Oh my gosh. Thank you, whoever wrote this, for calling out Peter's ball sack chin. We all think it every time we look at him. You have the space for a male between your ball sack and your butthole called your perineum. This area has specific nerves and blood vessels that can get compressed. If you've ever gone on long bike rides and everything feels numb down there, it's because you're messing with your pudendal nerve. Oh my gosh, they took him to the hospital.
So what do you think happened to my voice, Doc?
Oh my gosh, this is great. It doesn't happen that way. Your vocal cords don't change tone because you got kicked in the balls. You might not want to speak because you hurt, but it doesn't have any effect.
Peter, I'm afraid you suffered something called Pendleton balls.
Pendleton balls.
Here's a video explaining everything.
Pendleton balls. A painful condition where your testicles get lodged next to your voice box.
Sometimes you can actually have an undescended testicle, or when it's very, very cold, the scrotum shrinks up and the testicles kind of come up in a little bit, but they shouldn't be going intra-abdominal. So no, your testicles cannot go right next to your vocal cords.
Don't worry. With the help of gravity, Pendleton balls will clear itself.
Isn't there anything I can do to help my voice get back to normal faster?
I don't know. I just like putting on videos.
If you have testicles that go inside, you need to see a urologist, and it's an emergency. You always worry about blood supply related to the testicles. And if you don't have blood, you don't have oxygen. If you don't have oxygen to the tissue's going to die. If that happens to both testicles, then you're going to run into the problem where you might become infertile. What the hell? He's stuck to the couch. It happens. It's almost like an open wound that's then healed into the couch. Somebody puts a bandage on you and then it dries and the bandage sticks to your wound. It's the same idea because the tissue is healing with that type of fabric around it.
You'll be fine. Here's a video to help you understand.
Oh my God, this doctor and his videos. No, just talk to your patient.
When a fat guy's sweaty skin presses against couch fabric for an extended period of time, the fabric fibers fuse together with the skin.
So, almost right. It happens to everybody. The idea that the fibers are being grown in, the fibers don't do anything. It's the body's uptake of them.
The procedure is called rip you off real fast. Very painful.
Ripping it off like a Band-Aid. As you rip it off, you're going to open up the wound.
Ready?
Actually, I've decided to keep the couch on me.
Really? Are you sure?
Oh, yeah, this is nothing.
Can Peter actually walk around with a couch that heavy around his back? He's going to have a lot of lower back pain. When you lift heavy objects, you need to lift with your knees, because if you bend over at all, you're going to put too much strain on your lower back and be in a horrible situation.
My back.
Peter, enough is enough.
Uh-oh.
That couch is coming off.
Yeah.
You wouldn't put bandages around somebody's neck like that because you can cut off circulation to their brain. He's on a ventilator. Kinda how we do things. It's pretty close. They did a good job by how it's fixed to the face. We have something that has pads and that wraps around the tube so the tube doesn't move.
He's in what we call a coma.
He's not in a coma.
It's not a
Coma. And we don't even call it comas. We just say he's unresponsive. People can be in a coma for years. And then that becomes medical, legal, ethical situation relating to the family, patient, and the doctors that are taking care of them. Oh, we're at a burger joint. Nice.
Peter, you should really slow down. You've already had like 30 hamburgers.
Shut up, Brian. It relieves the pain of mustache.
Oh my gosh.
And it's working.
I no longer feel the pain.
Oh, it's emotionally eating. I very rarely eat hamburgers. Typically when I do, it is very lean hamburgers.
Very lean.
Balanced diet is key.
Come to think of it, I can't really feel anything on the left half of my body.
Really? That doesn't sound good. Peter, are you winking
Oh no,
at me?
he's stroking out. Twitching.
Someone call an ambulance.
Are strokes caused by diet? Not immediately. A long-term bad diet could lead to other medical problems, which then increase your risk for having clots.
Doctor, what happened? Is he gonna be okay?
Mrs. Griffin, your husband has had a stroke. The left half of his body is completely paralyzed.
Oh my God. Peter, sweetheart.
I love that his eye is totally drooped down. No, that wouldn't happen. Most of the time you see it in the lower part of the face. Typically the forehead is spared. That's also how we determine the difference between Bell's palsy as well as a stroke, because in Bell's palsy the whole side of the face is involved, including the forehead.
Had better days, Lois. Had better days.
He just has a motor function deficit. Sometimes you can have expressive aphasia. Somebody understands the words are coming into the brain, but when they try to say something, they'll say, "Hey, Dr. Wagner, how are you?" And I'll say, "Dog, cat, baseball." I don't think you should be driving. If you have a stroke where you have massive deficits, you're likely going to get your license taken away anyway or suspended for a short period of time. Typically, we do the same thing if somebody's had a seizure. You can't drive for 6 months unless you're cleared by a neurologist. Oh my gosh, why is he in the basement?
Peter, are you okay?
I was down there all night. So
if he's down there all night sleeping on a hard floor, you increase the risk of having muscle breakdown called rhabdomyolysis. You also are very concerned about kidney failure because the breakdown of the muscles clogging up in the kidneys.
Oh my
Why
God.
did he age? Look at the grays.
It turned white.
What?
Stress is one of the big ones that can actually cause that. I have grays. I work really hard, but a lot of times it's really a change of hair color is related to genetics.
Oh, how'd you get white hair again?
He was scared of a ghost.
Yes, I remember hearing about this in mid-school. Or was it a Scooby-Doo?
Dr. Hartman is the worst doctor.
What do I do now? I mean, should I diet?
Diet. Yeah.
I don't know why you'd ask me that. I mean, I don't know anything about that. How does one even go about dyeing one's hair? I've never heard of anything so crazy.
The guilt of dyeing her hair, Lois. It's okay if you dye your hair. It's fine. If you want whatever color you want, dye it. Get after it.
Let me get that for you, Doctor.
What? Oh, no, I'm not a...
Morning, Doctor.
Wow, Peter, they all think you're a doctor because you're white. I have to say, it does make you look more distinguished.
That's hilarious. Really? I will say, as a young physician, people call me by my first name a lot. You know, if I was older and I had gray hair, you wouldn't call me Jordan. You'd call me Dr. Wagner. At the end of the day, that doesn't really bother me.
You want a little something to put in that orange juice?
What? Why? It's 9 a.m.
Well, I figured you'd like to start your day with a stiff one.
You can't get a boner!
Oh, that's so messed up. They're referencing a morning erection. It's normal to have erections in the middle of the night, multiple times a night, but also we call it morning wood. That is normal.
You're a failure as a man and a father!
They're talking about giving him a stiff drink. If you drink too much alcohol, you're not going to be able to get a good, solid erection.
Peter, it's nothing to get upset about. There's treatments available.
If you're having difficulty with erections, there's multiple different reasons why that could occur. It could be your brain just worried about it. It could be decreased blood flow. It could be underlying medical conditions that are causing the issues.
Well, go see Dr. Hartman.
I don't want to do that. I'm embarrassed.
This shouldn't embarrass you. The size should embarrass you.
Oh my gosh. We all come in different shapes and sizes. The average is a lot smaller than everybody thinks, and most people are actually normal size, so don't worry about it.
How about now? Is this doing anything for you?
No.
What? Not appropriate. You can get sued, lose your career, lose your license, D, all the above. Does not happen in the hospital.
Doctor, what about Viagra or Cialis?
You have all these different medications to help with erectile dysfunction. Those are fine. If those don't work, then you can actually do injections. There's always implants that you can get to where it's almost like a pump.
What about them?
Well, if Peter could try them, they might help with his problem.
If you ever go to the hospital and you had a heart attack or you're having chest pain, tell them you're on one of these type of medications, because there's a medication that we give called nitroglycerin that if we give it to you while you're on these medications, we can tank your blood pressure and potentially kill you. So please let us know if you recently took that.
Those are for man troubles? I've been prescribing them as antidepressants.
Wow, Dr. Hartman, come on. They actually started as blood pressure type medications. The research was going down that road. They found out that it causes prolonged erections and helps with flow to your penis.
You guys are ready for a healthy dinner. I went to Whole Foods today and got this recipe from an extremely thin man with a giant Adam's apple.
I hate that place. None of the cereals are advertised on TV.
Whole Foods is a grocery store basically here in the United States. They sell products that are organic, no Captain Crunch, there's no Count Chocula.
What's this stuff that looks like sand?
It's quinoa.
Oh my gosh, I love it. It's quinoa. It's got a lot of nutrients that are packed into it, so it's very good for you.
Nope, I don't eat foods that sound like karate words.
Well, according to Food Kills, quinoa
There
is
you
a
go.
superfood. It's very nutritious, and it even helps keep you regular.
Keeps you regular, aka makes you poop.
Lois, I have a system. I poop once a week for an hour and a half.
Oh my god, oh my god, oh my god. Once a week, an hour to an hour and a half to poop? No. You should be going once a day. You don't want things just sitting in there. That means your gut is moving slow, so to speak.
I wear a headband and it's soaked when I'm all done.
It shouldn't be an exercise routine. It should be like something smooth and easy. Look into it. If you're not pooping every day and you're having pains with pooping, definitely talk to your doctor about it.
Ugh, fine.
Yeah, it's good. Quinoa is definitely good. Oh my gosh, stop it. It's gagging. Stop it.
Peter, knock it off.
I can't help it. My body's rejecting it.
Sometimes when people introduce new foods into their bodies, it will cause cramping, abdominal pain, just because the body hasn't seen it, so it may actually be uncomfortable, so to speak.
I guess I see where some of your anger comes from.
This is like roller derby. This used to be on TV like a long time ago. I don't know if it's still on TV or not. Oh, that's messed up. At least she's wearing her helmet. The leg definitely looks a little uncomfortable. She's got some bruising already to her face. Like, uh-oh.
That's it. I have to do something.
Chris, what are you doing?
Saving my...
Oh! Oh my gosh. Being run over, you always worry about fracture of the hand. You can potentially get compartment syndrome where it's like swelling in an area, then it actually needs to be cut open.
Dr. Hartman, is my brother going to be
He's
okay?
going to be fine.
That's her. That's her. Hi, Juanita.
Hello, doctor.
Oh my gosh, totally inappropriate. Dr. Hartman is
weird?
so inappropriate.
You don't know. I was fine.
Looks like Chris has a cast on his left ankle and his right forearm. It's not even really on his wrist, because if you had a wrist fracture or a hand fracture, it would actually go all the way down to the fingertips.
Excuse me, aren't you Peter, the human stunt bag?
Well, that all depends on who's asking.
I'm a doctor about to conduct an experimental procedure to give bones to a jellyfish, but I'd like to try it on a human first.
What? Wait a minute. Doesn't make sense, because normally we experiment on humans last. When we're trying to figure out something new, we start more rudimentary and then work our way up through different species to see if the concept or the idea would work and is safe, and then you potentially use humans.
The operation was a complete success. What are you going to do now?
Well, the whole reason I had the operation was so I could go back to my family. But it's been so long. What if they don't love me anymore?
Peter, where do you think all those bones came from?
Whoa, my God, oh my gosh, oh my God. We see this a lot with kidney transplants. The need for kidneys is so high, especially in the United States. Being put on a kidney transplant list, you can be there for many, many years. Family members are actually your best bet if they're the same blood type.
My God, you mean it's your bones that are inside me?
Well, mostly. We picked up a drifter to fill in the torso.
Oh my gosh. I've never seen a bone transplant. In the emergency department, we don't see that. But we'll occasionally get rejected transplant patients.
A family of freaks is better than no family
Oh
at all.
man.
Let's go home. You know what's really weird? This was covered by my HMO.
That's so funny. It brings up just a good point. Sometimes medical conditions occur and our family members could help. And if you're in a situation where you can actually help one of your family members, I highly recommend it if you can do it.
We have to fight fire with fire. If nuclear refuse gave them superpowers, it could do the same for me.
We see all these movies where people get these weird superpowers because it manipulates their DNA due to like toxic waste or something from outer space. No, it doesn't happen that way.
Citizens, I'm off to the toxic waste dump.
Radiation exposure definitely is not good for your cells. It could kill your cells, it can cause them to mutate, and a lot of times too much mutation could cause to cancer or abnormal growth. Oh geez. Oh, this is not gonna be good.
Mayor West, you have lymphoma.
I told you! Lymphoma, which is cancer of your lymph nodes. There's different types of lymphomas, and then lymphomas can turn into leukemias, so yeah, not good.
Oh my.
Probably from rolling around in that toxic waste.
I see.
What in God's name were you trying to prove?
I was trying to gain superpowers.
Well, that's just silly.
Silly, yes. Idiotic, yes.
There are many situations that I've been in where somebody has tried different alternative therapies, and then we talk about it, and at the end of the conversation, it was like, well, that probably wasn't the smartest thing.